I just got off the phone with a referral of one of my customers. He's been paying over $1,500 a month for health insurance on his family through his employer. To have a $5,000 deductible per person HSA plan, $10,000 for the family. So he's been basically paying all of his own healthcare costs out of his own pocket this whole year. And he's paid $1,500 a month for the privilege to do that. That's just crazy to me. He just left his job because his company that he owns is actually making more money now, and it's made enough that he can replace his income from that job. So he called me to see what his options were. And if you hang loose for just a minute, I'll tell you what we did to lower those costs by over 50%. But first, let me ask you a few questions. Are you as sick and tired as I am of this whole health insurance, healthcare fiasco? Are you as sick and tired as I am of paying through the nose for a plan that has these huge deductibles? Does your employer pay a good amount of your own premium, but to add your family, the cost to you is an arm and a leg? Or do you work for yourself or for a company that doesn't furnish health insurance, but you make too much money to get a subsidy on the government website, so you pay both arms and both legs? Do you ask yourself why you even have health insurance in the first place? Because you feel like you're paying everything out of your own pocket anyway. Are you sick and tired of changing plans every year? Are you sick and tired of worrying if your doctor's in or out of the network? I mean, I could go on and on. I mean, what the heck? My name is Tony McDougall, and I'm the president of AssureCorp. I've been the vice president of 2 insurance companies and on the field advisory board of several others. I've been in this business for over 34 years, and this is the craziest this industry has ever been. I'm going to be honest with you here, and I'll probably get a lot of flack for being honest with you on this thing, but it's not our fault. It's not your fault, and it's not even your employer's fault. Then whose fault is it? The insurance companies? Yes. The pharmaceutical companies? Yes. The big hospital conglomerates that are buying up everything around them, who are buying your doctor's office and the lab companies and the imaging companies and creating this huge monopoly where they own everything in the that has to do with healthcare in your area? Yes. Or is it the big government folks who are taking bribes from the big insurance companies and the big pharmaceutical companies and the big hospital monopolies? Yes. By the way, did you know that the big insurance companies and pharmaceuticals and hospital monopolies and all that, they are paying more on lobbying our congressmen than the oil and gas industry, the automotive industry, the national defense industry, or any other industry by far? I mean, they're buying up our congressmen so that they can write these stupid laws. That Affordable Care Act, there's nothing affordable about this thing unless you are lower income, unless you don't work for a company that furnishes your insurance and you don't make very much money. There's a small segment of the population that actually makes out like a bandit with this new law, but it's financially killing most of us. So who has it helped? Look around. I call them the healthcare syndicate or the healthcare cartel or the healthcare protection racket, whatever you want to call them. They are price fixing our healthcare so that you and I believe that we need insurance companies in order to get healthcare. Did you know that this stupid law mandates that insurance companies pay out 85% of the premiums that they bring in? If they don't pay out 85% of their premium in healthcare claims, then they have to refund the difference? I mean, that sounds like a great thing on the surface, right? But think about it. In order for the insurance companies to make more money, they have to pay out more claims, right? So that they can jack their premiums up, right? Well, in order for them to pay out more claims, the hospital monopolies and the pharmaceutical monopolies have to charge more, right? That's how they came up with this whole healthcare insurance protection racket in the first place. Let me just say, these hospital systems have this thing called a charge master where they list out every little thing that they could possibly charge you for, and they've jacked the rates up through the roof. They have this list price for all of this stuff that's just through the roof so that they can reduce the price to the insurance company. You see, our cost, the actual cost of healthcare, has not actually increased 10 times the inflation rate like we hear about all the time. It's only the list prices that have. See, hospital monopolies and pharmaceutical monopolies jack up their rate so that they can give the insurance PPO monopoly a discount of 50 to 90%. Those huge bills that we see, the $10 Tylenol and the $20 Band-Aid, only you and I pay that. And that's only if we have these huge deductibles or we don't have insurance and we don't ask for a discount. The insurance companies don't pay that. They have a pre-negotiated discount. That's what PPO stands for, Preferred Provider Organization. The providers are preferred if they play the game, if they jack up their list price so that the insurance companies can get a discount, and so that you and I believe that we need the insurance company to protect us from the hospital monopoly that owns our doctor, by the way, and the pharmaceutical monopolies and all of the healthcare racket that's out there. It's a racket. Zen. I don't know. Would you believe me if I told you that we don't actually need insurance companies in order to get health care at a reasonable price? Would you believe me if I told you that we don't actually need health insurance companies, that you could actually tell your healthcare provider, such as your doctor or a lab company or even a hospital, that you don't have insurance, and then just ask them for their cash price, and they'll drop the price by over 50% right there on the spot? Would you believe me if I told you that there's these doctors out there that don't even take insurance? They're called direct primary care, and that you can pay them monthly instead of paying the insurance company, and that you can go to them anytime you want to, and they're dirt cheap because they don't take insurance. They don't have to employ dozens of staff members just to do all their medical billing, so they can spend time with you. Their costs are way low. Would you believe me if I told you that if you paid cash for your prescriptions, that you could actually get them cheaper than your copay? A lot of people don't realize that. And it's just because your pharmacist has had a gag rule on him by the insurance companies where he couldn't tell you that it'd be cheaper for you to pay cash. Check out this website called GoodRx, GOODRX.com. They have an app for your phone too. And you can see the cash prices for prescriptions right there. Anyway, I could spend all day talking about this and going on all this, but there's so many ways to get our health care for a lot less than buying an Obamacare policy, even one through our employer. We don't really need health insurance companies. I know that's crazy to hear, especially from a guy who's been in the business for over 3 decades, but it's true. Okay, rant over. I'm through here. If you have any questions, post them in the chat box below, and I'll try to answer them. By the way, the guy that I just got off the phone with, we were able to lower his costs, his out-of-pocket expenses, his premiums, everything by more than 50% by just having him use some unorthodox tools and just having him say no to the healthcare cartel, the protection racket. Anyway, y'all have a blessed day. Rant over. Bye.